The next thing I want to talk about is how I got started. So I'm actually a board certified family physician, and my first job out of residency was a small town in Alaska. And so I did everything. I was the ER doc, and I delivered babies, and I saw people in the clinic, and I saw people in the hospital and in long-term care. And so I did a lot of different things. And my patients would sometimes tell me that they're struggling with chemical dependency, but overall I didn't really hear that much about it, and I fear that was because people didn't think that I wanted to hear about it, which was probably true, because I didn't have that many tools to deal with it. But one day, a young man with a family came into the office and he asked for help. He said, "I'm really in trouble. I'm using pain pills," and I actually had been prescribing him pain pills for his shoulder. But he told me, the shoulder's really not the problem anymore. I'm really stuck on the pain pills, and I want you to taper me off. And so, take a little bit less, a little bit less, a little bit less. And that really, once somebody says that they're struggling with opioid dependence, the DEA just really doesn't allow you to taper them off. There's laws and all these restrictions about that. And so I couldn't legally help him, and I felt really trapped, and I wanted to help him. And so I talked with a friend of mine who's a fellowship trained addiction psychologist in Seattle, and I said, I don't know what to do. And he said, "Get your Suboxone license and help this guy. And so that's what I did. I got my Suboxone license. And at the same time, I really evaluated my chronic pain practice, and I got everybody to sign contracts and those sorts of things. And so once it was all set up, I felt like if I found that my patients who were taking pain pills were struggling with chemical dependency, that at least had something to offer them, rather than saying, "All right, I can't prescribe you pain pills anymore because you've developed chemical dependency. Now, I'm going to throw you out on the street," and which isn't any good for anybody. And so I got my Suboxone license. I called all of my chronic pain patients in to be evaluated. I thought that I had been very careful about selecting patients who I thought had real legitimate pain issues and who had good control over the pain medicine. And I found out that about half of my patients could not pass a pill count, could not pass a urine drug screen, meaning that they either were overusing their pills or they were getting pills from multiple doctors, or their urine had multiple drugs of abuse in it. And so it turns out that for half of my patients I was wrong, and they weren't doing that well with their pain medicines, and either they had pain plus chemical dependency or a problem with chemical dependency, or their pain really wasn't the primary issue. The primary issue that they were dealing with was chemical dependency. And so when I moved to Hawaii, they mostly wanted me to deliver babies, but I said, well, I'm not busy enough delivering babies. I'd really like to start treating people who struggle with chemical dependency too. And there was a lot of pushback. There was a lot of like, well, we can't have these people, come into the clinic and mix, and I was trying to explain to them, they're already here. They're us. They're our employees, and they're our families, and those sorts of things. To think that there's some outside group that's struggling with chemical dependency is just completely wrong. They're already here. Some of them want to ask for help but don't trust the system. Others need help, but they're just getting pain pills and trying to kind of work through the system to get what they think they need, and it has turned out to be pretty good. So that was in 2009 when I came to Hawaii. And so overall, it's been pretty good. Now, I have also developed a small pain management practice, initially because there were doctors who had patients who were taking high doses of opioids, or who had a history of chemical dependency, and they weren't sure whether they were treating the chemical dependency or the pain problem. And so I started to get referrals for people who the other physicians on the island just didn't know really what was going on. And so I tried to assess them and those sorts of things. And, in my experience, somewhere between half and 2/3 of patients that I would accept into my chronic pain practice would eventually not be able to pass a urine drug screen or a pill count. And so they, generally are offered a place in the chemical dependency program or Suboxone. And some of them, are interested in that, and some are not. Some people, really accept, when I say, I think you have a problem, people are ready. They're like, I do have a problem and I need help. And other people are not, and they're angry, and they kind of reject my offer for help. But that's kind of how I got to be where I am today, delivering babies, helping people as best I can with chemical dependency, and also having a small chronic pain practice.